What is herpes simplex virus? The herpes simplex virus, also known as HSV, is an infection that causes herpes. Herpes can appear in various parts of the body, most commonly on the genitals or mouth. There are two types of the herpes simplex virus. HSV1 primarily causes oral herpes and is generally responsible for cold sores and fever blisters around the mouth and on the face. HSV2 primarily causes genital herpes and is generally responsible for genital herpes outbreaks. The herpes simplex virus is a contagious virus that can be transmitted from person to person through direct contact. Children will often contract HSV1 from early contact with an infected adult. They then carry the virus with them for the rest of their lives. HSV1 can be contracted from general interactions such as eating from the same utensils, sharing lip balm, kissing. The virus spreads more quickly when an infected person is experiencing an outbreak. An estimated 67% trusted source of people ages 49 or younger are seropositive for HSV1, though they may never experience an outbreak. It's also possible to get genital herpes from HSV1 if someone who performed oral sex had cold sores during that time. HSV2 is contracted through forms of sexual contact with a person who has HSV2. An estimated 20% of sexually active adults in the United States are infected with HSV2, according to the American Academy of Dermatology, AD. HSV2 infections are spread through contact with a herpes sore. In contrast, most people get HSV1 from an infected person who is asymptomatic or does not have sores. Hey, do you want to permanently eliminate herpes virus from your body? Then link is on the description. Anyone can be infected with HSV, regardless of age. Your risk is based almost entirely on exposure to the infection. In cases of sexually transmitted HSV, people are more at risk when they have sex, not protected by condoms or other barrier methods. Other risk factors for HSV2 include having multiple sex partners, having sex at a younger age, being female, having another sexually transmitted infection, STI, having a weakened immune system. If a pregnant woman is having an outbreak of genital herpes at the time of childbirth, it can expose the baby to both types of HSV and may put them at risk for serious complications. Signs of herpes simplex virus. It's important to understand that someone may not have visible sores or symptoms and still be infected by the virus. They may also transmit the virus to others. Some of the symptoms associated with this virus include blistering sores in the mouth or on the genitals, pain during urination, genital herpes, itching. You may also experience symptoms that are similar to the flu. These symptoms can include fever, swollen lymph nodes, headaches, tiredness, lack of appetite. How to prevent the spread of herpes simplex infections. You can take measures to avoid contracting the virus or to prevent transmitting HSV to another person. If you're experiencing an outbreak of HSV1, consider taking a few preventive steps. Try to avoid direct physical contact with other people. Don't share any items that can pass the virus around, such as cups, towels, silverware, clothing, makeup, or lip balm. Don't participate in oral sex, kissing, or any other type of sexual activity during an outbreak. Wash your hands thoroughly and apply medication with cotton swabs to reduce contact with sores. People with HSV2 should avoid any type of sexual activity with other people during an outbreak. If the person is not experiencing symptoms but has been diagnosed with the virus, a condom should be used during intercourse. But even when using a condom, the virus can still be passed to a partner from uncovered skin. Women who are pregnant and infected may have to take medication to prevent the virus from infecting their unborn babies. Hey, do you want to permanently eliminate herpes virus from your body? Then link is on the description. If you like the video, give it a thumbs up and share it with your friends. If you want more recipes and tips, subscribe to the channel.